In this video, we will be talking about the Webber and the Rinne test. So, in order to understand these tests, these are clinical tests that are used to know if the patient is suffering from a sensory neural hearing loss or the conductive hearing loss. So, first, let's talk about the general anatomy in order to understand the types of hearing loss. So, what happens is that in the ear, we have the external ear, the middle ear, and then the internal ear. So, in the external ear, we have the pinna, and then from the pinna, we have the external auditory canal, and then we have the here we have the tympanic membrane that separates the external auditory canal from the middle ear. So this is the external ear, this is the external ear, this is the middle ear, and then internally we have the internal ear, then the internal ear, in which there is a lot of fluid called the endolymph. And here we have let's say this is the trachea, and from the trachea we have a nerve, the auditory nerve, the cranial nerve 8, that is going to the brain, that is going to signal the brain. And the specific area of the brain, that it signals is a temporal lobe of the brain. So brain, temporal lobe. So now let's talk about what the types of hearing loss are. So this diagram is actually really highly simplified just for the purpose of understanding and simplification. So type of hearing loss. So the first we have two types of hearing loss. The first is the conductive hearing loss. Conductive, and the sensory neural hearing loss. So first, let's talk about the conductive hearing loss. So first, let's have a general idea of how the sound is kind of conducted. So first, we have a sound, which are waves. So let's say there is a sound that is produced by any instrument. Let's say we have a speaker here, and it produces sound, and then in the ear the sound produces the waves, and the waves then are collected by the pinna, and the pinna can also actually tell you where the sound is coming from, so because of its design. And then these sound waves will come here and enter the external auditory canal, and then it will then vibrate the eardrum, and from the eardrum it will be conducted through the middle ear by something called the auditory ossicles. So we have here auditory ossicles, let's say, and then from the auditory ossicles, the stapes is going to connect. The foot of the stapes is going to connect the middle ear with the internal ear. And as the stapes vibrate, it will vibrate the endolymph in the middle ear, and that will then stimulate the hair cells, the cochlear hair cells, and from then on, the signal is going to be carried by the auditory nerve to the brain temporal lobe. So this was a pathway of how the sound waves are conducted by the ear. So then let's talk about the conductive hearing loss. So conductive hearing loss occurs when there is anything that gets in the way of this whole process of conduction through the external auditory canal, through the external auditory canal, and also through the middle ear, but not the internal ear. The internal ear is a separate thing. So what can be the causes they can do that? So for example, we have let's say we have a cerumen, which is or impacted wax here. So impacted wax can get in the way, and then the sound waves cannot be conducted further. So that's the first. Then there's going to be an infection here, so external otitis externa. So it can also result in edema and also and fluid buildup that will get in the way of this sound transmission. Then the second cause could be problems with the eardrum. So the eardrum, for example, is perforated, so it will not be vibrating well, and that will result in hearing loss. That's another cause of conductive hearing loss. Then in the middle ear we have the ossicles. So if there can be a problem with the ossicle, thinking it can result in conductive hearing loss, for example, otosclerosis, in which there is sclerosis of the stapes. And so that's one cause, and also otitis media, in which there is inflammation in the middle ear. They can also result in conductive hearing loss. So these are general causes of the conductive hearing loss. Then in the sensorineural hearing loss there is a problem basically with the nerves, which the cochlea, the hair cells, and the auditory nerve are the central pathways. So, for example, Meniere's disease is one cause, and also vestibular schwannoma is another cause. So these are the sensory hearing loss causes. So now let's then talk about how are we going to clinically know if the patient is suffering from a conductive hearing loss or sensory hearing loss. So for that we have two tests. First is the Webber test, and the second is the Rinne test. So let's talk about them. So this is the patient here. And let's first talk about the Webber test. So in the Webber test, we put the base of this tuning fork. First, we'll vibrate the tuning fork by striking it against like the elbow, and the base is then going to be placed in the middle of the forehead of the vibrating tuning fork. Let's see, these are the ears. And another important structure that we should also draw is, let's see, this is the mastoid. Okay, so when the vibrating tuning fork normal, let's first talk about the normal person. So now if a normal person, if the vibrating tuning fork is placed here, where is the sound going to be better heard, here or here? The answer is it will be in the middle. So it will not be lateralized to either ear, in the right ear or the left ear. Okay, it will be in the midline. But let's say this sound lateralizes to the right ear. So what could be the cause of this? So well, two things could cause this. So number one would be if the sound lateralizes to the right ear. So number one could be because the right ear has a conductive hearing loss. Conductive hearing loss. Number second could be the left ear has a sensory neural hearing loss. So let's explain this. So whenever there is a conductive hearing loss, then the conduction through the bone, not the ear. Okay, so now we haven't talked about the ear conduction and the bone conduction. So the ear conduction means that you're actually holding the tuning fork away from any bone structures. You're just holding it in the ear. So you're letting the ear do its job. It is dependent on the ear. So that's ear conduction. Okay. In bone conduction, you put the tuning fork on the bone, the mastoid bone or any bone. So the bone is doing the job of transmitting the sound. So anything that gets in the way of the air will interfere with the air conduction. Okay. So these are the things that we talked about, the conductive hearing loss causes, which are the cinnamon or the impacted wax or all of those things. So they can impede the air conduction. Okay, and so in conductive hearing loss, there will be more conduction through the bone. The reason for that is normally we hear the ambient noise in the environment, and when there is blockade of that conduction of that ambient noise from the environment because of the conductive hearing loss, then the conduction through the bone is going to increase because there is cancellation of that noise. So there is no noise, the ambient noise from the environment, then the bone conduction is going to increase because of that. So that's the first thing. So the bone conduction is increased because the right ear is having a conductive hearing loss because of the loss of those ambient noises in the environment. So that's the first thing. Then number second is it could be because of sensory neural hearing loss in the left ear. So let's explain this. So if we have decreased decreased hearing because of the nerve problem here, then so if we have sensory neural hearing loss in the left ear, then the patient obviously is not going to be hearing as well in this ear, and the sound is going to be more heard on the right side. So if there is a conduction to the right ear, then it's either because of the conductive hearing loss in the right ear or sensory neural hearing loss in the left ear. So then the question arises: how do we know that the right ear is having conductive hearing loss or sensory neural loss in the left ear? Well, for that we do something called the Rinne test. So in the Rinne test, what happens is that we have the same patient here, and we have the mastoid here, and we have the tuning fork here. So what happens in the Rinne test is we check the air conduction and the bone conductions here. So the vibrating tuning fork is placed in order to check the air conduction. The tuning fork is placed just closer to the pinna, and then the conduction is then checked. The patient is asked how he's receiving those sounds, and in the bone conduction we put the base of the tuning fork, at the mastoid, and then tell the patient how the patient is hearing. So first, if there is lateralization to this to the right ear, and if it is because of the conductive hearing loss, then this conduction, which is the air conduction, this conduction is the air conduction. Air conduction is going to be less than bone conduction, or bone conduction is going to be greater than air conduction, because we talked about the ambient noise. Okay, the noises are cancelled, so but the bone conduction is going to be greater in the conductive hearing loss. So they will confirm that we have conductive hearing loss in the right ear. So this is how you know whether the ear is having a conductive hearing loss or a sensory hearing loss after doing the Webber test. So, but let's say if we do the Rinne test, it shows air conduction in this ear greater than bone conduction. That would mean that this ear is normal. Okay, if we can only say that this ear is normal if in the Webber test it is lateralized to the right ear. Okay, so that, and the opposite ear is then having sensory neural hearing loss. So in the summary, so let's talk about this, what we learned here, just to summarize. So we have the Webber here and the Rinne. So what happens in a normal person, normal or healthy ears? In the Webber, there will be no lateralization. You will not hear better in any ear. It will be just equal or midline. Rinne test, we will have in both air conduction will be greater than bone conduction. And in the conductive hearing loss, in the Webber, so affected ear lateralized. Okay, it will be lateralized to the affected ear. Okay, so that's it. Then in the Rinne test, in the affected ear, bone conduction is going to be greater than air conduction. Okay, that's it. And in an unaffected ear, air conduction is going to be greater than bone conduction. Then sensory neural hearing loss. In the affected ear, the sound is going to be away from the affected ear. and it is gonna be lateralized to the unaffected ear. And Rinne test in both ears, it is going to be actually normal. It is going to give you normal results in both ears. The ear conduction is going to be greater than bone conduction. So hope this was helpful.